Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video we're going to talk about how to treat a fracture. Now a fracture is a break in the bone and that can be incomplete or complete. And usually it's the result of direct trauma or injury. They tend to happen in either children who are very mobile and accident prone, or in the elderly whose bones may be at risk. Signs of a fracture include pain at the affected site, deformity or swelling, bruising around the area, and in small children they may not be using the limb that's affected. It's important to know that all fractures require medical attention, so you will have to go to hospital, but there are some things that you can do at home in the meantime. First and foremost, immobilize the injury. You can do this just by wrapping it in a towel and keeping it very still. Not only does that actually help prevent you aggravating the injury, but it will also help in the pain control. If you know how to make a sling and it's an arm that's affected, then it's always a good idea to try and put it into a sling, and there is a video jug video to do that. It's also a really good idea to put ice on the injury. This will help limit some of the swelling and also help with the pain. And finally, taking painkillers such as paracetamol or ibuprofen can be really useful in controlling the pain as well. If you have suffered a fracture and it's likely that you have to go to hospital, try not to eat or drink anything else because there's a possibility you may need an operation to repair it. Once you get to hospital, your injury will be assessed, and if necessary, you will be given extra pain relief medication. You may undergo tests like x-rays to assess the extent of the injury, and then you may need to go into a plaster cast if appropriate and the injury isn't too bad. However, if the fracture is quite complex or it's broken the skin, then it's quite likely that you're going to need an operation, and that's often done by putting you to sleep. After hospital treatment for a fracture, you may be followed up in a fracture clinic that's run by bone specialists to make sure that it's healing properly. You may also require a period of physiotherapy to get the affected part back to normal use. Fractures take about 6 to 8 weeks to heal in most people, and it's a shorter time period in children. It is important that you get appropriate and urgent treatment to make sure that they heal properly. So if you think you or somebody you know or your child may have a fracture, it's important to seek medical advice as soon as possible. And that's how to treat a fracture.